It's ironic that healthcare, through the environmental impacts that it has, actually hurts our health.
It just doesn't make sense to be healing people and at the same time to be degrading the environment.
You can't necessarily just address the patient without addressing our environment as well, because they're inextricably linked.
We generate so much. I mean, we generate a lot of garbage.
I think especially in my field, cardiac surgery, we use so much disposable equipment.
Plastics have been around for about 100 years, and they take about 700 years to biodegrade.
We use a tremendous amount of power.
Hospitals and the healthcare industry is second only in its energy consumption to the defense industry. And just hit me between the eyes a little bit in recognizing just how significant of a contributor hospitals are to the problems that we're facing environmentally. And as other industrialized nations come into their own, from a moral and ethical perspective, can we deny them the quality of life that we ourselves continue to try to pursue? And the answer to that is not really. How can you? Fundamentally, we're going to have to look at doing things differently across our nation.
It's a profound change that we're going to have to make as a citizenship, which is really consumership right now.
I'm born and raised in Montana, and I mean, obviously the weather has changed dramatically since I was a kid.
We live next to, or very close to Glacier National Park, and the effect of climate change clearly impacts us. And it's very possible that my children's children will not see a glacier in Glacier National Park.
We all would like to ensure that what we're leaving for our children and our children's children is something better than what we got. And right now, the direction in which we're going, that's not going to be the case, and I think that that's an atrocity.
Everybody works against change, but change is how we improve, and change is inevitable. So we need to find better ways to change.
I think we're very well aware that our Earth is vulnerable right now and needs our attention and care. As people of Providence, what does our mission call us to?
We have the core value of stewardship, and our core values and our mission provide the foundation for our strategic planning process.
So once it's in the strategic plan, it gets the attention on a regular basis. Then our focus on the earth and caring for the earth and caring for one another on this earth is just the natural outflow of that.
The more that people see that there are things in the organization that support environmental sustainability, the more it reinforces the message that we're trying to get across and the education that we do. And I think that then has to get translated into how things are done in the organization.
We changed from 32-watt fluorescent bulbs to 28-watt light bulbs. When you're talking about thousands of light bulbs, it added up quick. We started using well water for cooling in 1992, and ever since then, the drive has been to be more efficient. A year and a half ago or so, we installed these dry coolers so that at outdoor air temperature of 30 degrees, we're able to shut the chiller off and divert the chill water up here, and that saves us about $500 a day. Normally, in November, they'd be running right now.
While it's important to conserve energy wherever we can, what we really need to get to is energy neutral or carbon neutral. This is one of the areas where we simply have to change the way we do things.
The concept of being a carbon neutral hospital is something I think that everybody should consider as they are looking at expanding their facilities.
To institute an organization-wide initiative such as this requires involving as many of the 1,400 staff we can, and the 250 physicians, and the 250 volunteers, and the maybe 1,000 visitors that come through. One of the things that we did was a 6-week rollout to look at 6 different topics. We chose energy, paper, toxins, plastic bottles, recycling, and carbon footprint to take 1 week in the spring and look at each topic in some depth with signs, with emails.
You just keep talking about it, you keep putting it out there, it aligns with people's personal values.
A large institution taking on sustainability both reflects all the people who work here and are already committed to it, and also ask them to work harder and reach a little further in their efforts.
There are so many things that each of us do in our individual daily work lives that we could do a little bit differently.
You know, having more available water dispensers within the cafeteria rather than picking up bottled water. Using one less paper towel when you dry your hands.
Every time someone does something that is positive for the environment, whether it's turning out the light or taking their bag to the grocery store or using their own cup, it all just builds on itself.
It's not to do this to save money, or it's not to do this to save energy. It's to do it out of a sense of compassion and care and respect for one another and for the earth.
We will step out and make this visible, not just internally, but to everybody in the community. And hopefully we can get other people to really recognize the importance of everybody being involved in this effort, not just at an organizational level, but at in their personal lives as well.
We have had, right from the very beginning, some employees and even new employees who have said, the reason why I'm interested in staying at St. Pat's is because you care about this stuff.
There's efforts being made at this level to try to improve how the hospital thinks from a sustainability standpoint. I'm very impressed with that and glad to see that it's going on. Makes me happy to work here.
We've been able to attract and retain top quality physicians and clinicians at the bedside because of the caliber of care that we're providing, but also because of the lifestyle that Western Montana has to offer. And if we want that to continue, we do need to be playing a leadership role in making sure that we protect the environment and the resources that we have that make it an attractive place for us to live and work. And Missoula is very conscientious towards environmental sustainability and protecting our natural resources. I think that us ignoring our contribution on the wrong end of the scale is ludicrous and would certainly represent a very significant disconnect between us and the community at large.
My hope is that people do, at a very deep level, have an appreciation for the power of healing. And that on some level, all of us are more aware and more consciously willing to change our behaviors so that healing flows from us to the earth, to one another. When the sisters came to this area, there were already people here. Maybe it's coming full circle and learning what they always knew, that nothing belongs to us.
Our conscience is telling us that we need to really wake up to these facts and start proactively and aggressively addressing them. It's a must for us. It's an imperative.